So we want to bring in our chief health editor, Dr. Nandi, and Dr. Nandi weighing in on this new COVID treatment pill. Is the treatment expected to work against Omicron?
Hey, Glenn, it's great to give some good news, right? It's phenomenal that this Pfizer's antiviral pill Paxlovid received emergency use authorization. Yes, it is expected to work against this Omicron variant. And what I really like about this new drug is that it can be taken in your own home. Treatment consists of 30 pills, 3 pills taken twice a day for 5 days. Now, the people ask the question, who can take the oral antiviral pills? Well, you have to be at least 12 years of age, at least 88 pounds, and be at high risk of developing severe illness. The key thing to remember is that the pills need to be taken as soon as possible. And the data, Glenn, that was exciting, showed that the risk of hospitalizations or death was cut by a whopping 89% if the medication was taken within a few days of symptoms starting. The FDA statement says to take it within 5 days of symptom onset. Now, if you're wondering how you can get this drug, it's only available through a prescription. I think we talked about that. So while I'm excited to have this great new treatment for COVID-19, I want to stress it is not a replacement for vaccines, not a replacement. So please, if you're not vaccinated, please get vaccinated when you can.
So, Dr. Nandi, as coronavirus cases climb here in the U.S., we see it happening in our state. We want to know if it's possible to get infected with Omicron and the Delta variant at the same time.
So Glenn, I get the same questions from my patients. Many people are concerned, right, about this variant and what is going to be ahead of us. So now epidemiology experts, right, these are folks who research this, have indicated that people could get infected possibly with both the Delta and Omicron together. We've actually seen co-infection before. 2 studies, one in Brazil, one in France, have researched patients infected with 2 different strains of virus at the same time. But I don't want people to panic because the chances of this happening is rare. Science tells us that infection typically involves one strain at a time. What's most likely going to happen is that, with how Omicron is going and how quickly it's spreading, is that Omicron will push out Delta, just like Delta pushed out the Alpha variant.
All right, Dr. Nandi, finally tonight, how long should you isolate if you're fully vaccinated, but you end up having COVID-19?
So right now, if you have COVID-19, you need to isolate for 10 days, right? That's what the CDC guidance is telling us. Now, I know that the United Kingdom has shortened their isolation period from 10 to 7 days as long as the person takes 2 tests and both of them are negative. And there's a possibility that the US will follow, mainly because the concern that people like me, right, healthcare workers could end up sick due to Omicron, which could then lead to a serious shortage of hospital workers. Another reason to shorten isolation time is this, because vaccinated people who get infected tend to spread the virus at a lower rate than unvaccinated folks. But until the CDC changes the recommendation, please, if you're out there, stay home the full 10 days as we see how infective, how contagious Omicron can be.
All right, Dr. Nandi, thank you for the update. Appreciate your time.
Thank you.